Good morning. Welcome to a virtual presentation of our Prime Professionals Group, sponsored by Allegiance Home Health. My name is Chastity Navarro. I am the events manager here at the Chamber, and we're super excited that you are here today. It's a special treat because we don't always have our sponsor be our speaker as well, and they're going to be speaking on enhancing leadership, employee morale, and health during COVID-19. Okay, so let's get our presentation started. I'm going to introduce you to, well, many of you already know Rosie and Joe and could probably read their bio off the top of their head, but I'll do the official chamber thing. So I'll start with Rosie. Rosie Inguanzo-Martin is the president and CEO of Allegiance Home Health. In her position, she oversees patient care, operations, marketing, finance, human resources, safety regulations, compliance, and public relations. Rosie believes in creating a culture of caring, commitment, and communication within her business. Rosie has created a management team to help her guide employees to follow Allegiance's mission of delivering superior overall health care to meet each patient's individual needs in the comfort of their own home. She believes in leading by example. Mr. Joe Martin is the vice president and owner of Allegiance Home Health. He received his Master of Science in Physical Therapy from Nova Southeastern University and his Bachelor's of Science in Exercise Physiology from University of Florida. After his experience on training staff from the United States Tennis Association and Miami Dolphins, he began his 19-year career advocating and caring for seniors. I think it's probably more than 19 years now, Joe, huh? Joe owns and operated Martin Physical Therapy in Boynton Beach for 13 years, specializing in helping seniors regain their functional independence. He has owned and operated Allegiance Home Health since 2005 with his wife, Rosie. So we will go into the presentation.
Thank you. Thank you, Chastity. So today, Joe and I are going to speak about enhancing leadership, employee morale, and health during COVID-19. There's so many changes now, but change is not always bad. Change is good, and it creates a lot of innovative ideas.
Good morning, everybody. My name is Joe Martin, as Chastity said. Thank you very much for attending. We're excited about this. Just to tell you a little bit about Allegiance Home Health, we're a Medicare certified home health agency, which you could think of it as hospitalization at home. We serve Broward, Palm Beach, Martin, St. Lucie, and Indian River counties. Some of the things that we do are physical therapy, speech therapy, occupational therapy, skilled nursing, anything from a new diagnosis of a disease to somebody that has balance problems and has fallen. We also do we have a caregiving division where we provide companions and caregivers for those that need a little additional support at home, especially during these times, actually. Rosie, would you like to discuss that a little bit?
Yes, so our private duty department is headed by Debbie, and she's very, very caring. And if you need any help at home with grocery shopping, doctor's visits, even live-ins. We can have someone with you. We have found that private duty is something that actually keeps our clients or patients out of the hospital. It's very important, especially in a time of isolation. We've had a lot of calls because there are family members that cannot, prior to COVID, they could visit their loved one at a assisted living facility or their community, and now that is not being allowed. So we have had a lot of calls because their family members are now, through our caregivers, are able to connect with their loved ones. It's been something that we feel very blessed to do. The reason we started Allegiance is Joe and I had a Medicare certified outpatient physical therapy clinic for about 15 years. And 5 years into owning the agency, my mother actually became ill, and we could not find good home health for her. It was something that was very difficult on us, and at that time, we had created such great relationships with our patients at our physical therapy clinic that we knew that we could make a difference and we could really give dignity at home to seniors. And that's how Allegiance Home Health was created. And Allegiance is red, white, and blue. It was really in honor of veterans. We have family members that are veterans. My nephew is also currently serving in the Army. So there's a lot of meaning behind allegiance, just the word, because allegiance is really a word that means caring, and that we're here for you.
And just to add, and we'll get to the presentation in a second, Wendy mentioned a little earlier, Governor DeSantis did announce that he will be allowing visitors to enter healthcare facilities now. But there are still, they have, what am I trying to say? The individual facilities do have their own rules that are going to be followed. So it's not, anybody can't just walk in. They have to follow certain protocols, but that is the first step, and that is very exciting for family members.
It is. Yesterday we received a phone call from a family that we've been taking care of their father in a facility, and they have not seen him for 5.5 months.
Okay, so I think the first slide after this one is, we're going to discuss leadership. So it's basically, what is leadership? This is just by Donald, and I don't have my reading glasses on, whatever. Leadership is action, not position, right? So most people want to be led, unless you're in a leadership position, but leadership is all about action. It's not really about a job title. It's about action, and then we'll get into that as we go to the next slide. So these are some of the principles of leadership, right? For us, leadership hasn't changed much. It's just we adapted a little bit to COVID, because we want to relate all this to COVID-19, not just a lecture on leadership, morale, and health, right? So leadership involves these principles up on the screen, like a shared vision, creating a positive culture, communication, ensuring that everybody is aligned with the same vision that you have. And we always want to be employee focused and customer centric. But now this is all related to COVID. When we shared our vision, I want to let Rosie talk a little bit too. Rosie actually started with this is going back to just before St. Patrick's Day, when we realized that this COVID was going to start affecting everybody. Our son's college got canceled or went online. There was a lot of restaurants that were closing. New York was well into their pandemic. And we realized that we need to act immediately, or we were going to get left behind. So Rosie made a meeting, and interrupt me whenever you want.
Yes. So I had a mandatory meeting amongst the directors of our departments that we needed to act quickly. Change is not easy, but as a leader, you have to create goals, maybe change a little bit of roles, and talk about the silver lining. There is a silver lining in this epidemic. And the truth is, we have a new norm. And in our leadership meeting, we decided who should stay at home. To be honest with you, our leaders did not want to work from home. We did have a lot of pushback. They just could not imagine working from home. They didn't feel they could work as well. And that has not been true. Once they trusted us as leaders and they attempted to work from home, it actually has been very productive. They have found that they have been very productive at home. So it's just that change creates fear. But as a leader, if you're trusted by your employees and your higher management, who can also help you create this work environment that will be successful, it's something that's very important.
And as you notice, like with a lot of these are going to overlap. So our leadership principles create morale, and also instill protocols to help with the health of your employees and, in our case, patients. But as far as creating a shared vision, if we don't align that with everybody, our whole team, then that vision doesn't usually go down the direction that we intend it to go down. So ensuring alignment, you are going to get pushback, as Rosie mentioned. We didn't think we were going to get pushback from people working from home. We thought we were going to get pushback in other areas, but they were, and we're really blessed to have the employees that we have, that they actually thought they weren't going to get enough work done at home, and everything has been completely fine since. And we still haven't returned to our office except for some key employees that we need in our office. Also, as far as the positive culture, you always want to have a positive culture, right, as part of leadership. And now when you have a pandemic going on, it's hard to stay positive for some people. And you want to steer those people down the road of the glass is half full type of thing, because depending on how you look at things, I mean, I think Rosie used the word innovation earlier. There's a lot of innovation. We're doing more telehealth now in home health. There's all kinds of way of delivering care. I mean, hopefully the reality of all this is we all get less sick in the future now, because now we understand about infection control. We hear it on the news every night. So if we can find something positive out of all these things that are negative, the kids that are at home and can't go to school, and it creates a difficult situation for parents, and we need to find ways to create that positive culture and maintain that positivity through all this. And a lot of that is through communication and being employee focused. We've done the best that we can the past, I don't know how many months it's been, 4 or 5 months, to be employee focused. So when somebody tells us that, they think they've had an exposure, they think one of their family members may be sick, we've actually, I don't want to say allowed, because we set a protocol of quarantining, but we've paid everybody through their quarantined. We've allowed people time off if it's for certain. I mean, it's been a stressful time for, I'm going to say more for certain people and less for others. And those people who have felt the stress a little bit more, we've tried to be a little more understanding during these times, and definitely customer centric, because your customers it's really your customer and your employees is all you have. If you don't have customers and employees, you don't have anything. So you still have to maintain that customer care that you wanted to before all this COVID, but now it's even more so. Rosie even, mentioned like some of the we've actually grown part of our business because families call us about, they're worried about their loved one. They can't get in to see them at some of these facilities.
So when you talk about communication, I think empathy falls into place. So during this stressful time of COVID-19, it can cause fear and worry about your own health, about the health of your loved ones, financial situation, their employment. It might even affect their sleep, changes in sleeping pattern, eating patterns, difficulty concentrating, worsening chronic health problems, mental health problems, increased use of tobacco, unfortunately, alcohol. So there are things that as owners, as leaders, you have to empathize that everyone is afraid. We've had meetings where people have gone to be tested for COVID and the rapid test, and they're actually hoping that they have had it and didn't know it, because there is such a fear of this epidemic. I would also have to say about communication, leaders have had to learn how to use Zoom or GoTo meetings, and there are things that you have to think about when you're having these meetings. And because it may be something new to your business, because you are having your employees work from home, you have to make sure that that employees are seen. Actually, that their screen is on, so that you know that they're engaging in conversation with you. That your background, you should really have a clear background. Employees should actually dress professionally, and not wear their pajama top. I mean, and those expectations should be shared up front, so the employees understand that this is still a working situation. I mean, during this epidemic, you can choose to hide, or you can choose to be innovative, identify new opportunities, learn new ways of leading. And really, that's what I think all of us are are learning.
Yeah, and I think that's a good point about communication too. Like I'm in a whole different universe when it comes to technology. I'm back like in the 80s, and we've really had to learn. Even just doing this presentation, you know, Chastity could probably let you know the difficulties that I have just emailing a presentation to somebody. But you know, you learn new things, and that's part of the positive culture you create. We're learning new ways of communicating, and it's pretty cool that we have all these things where everybody can see each other and we can communicate effectively through technology. Just one last point on the bottom there, we thought it was important to put that little image because there's a chain that connects all parts. You know, you got your customer, you got your employees, you got the care that you deliver. And when you provide good leadership, whether it's at the departmental level, overall, your company, wherever it is, when you have good leadership, people trust you. And when people trust you, it makes everything go more smoothly.
And as far as trust, when your team trusts you as a leader, it increases their commitment to the company, to your company goals. Communication will improve. They will have more ideas because they trust that you will listen to their ideas and possibly implement their ideas. I think thought is something, or communication and listening to your employees is very important. It creates productivity. I think the most important thing is that employees feel comfortable with the change that you're making, especially the leaders of your departments. And that way, I think they will be more willing to embrace the new vision that you have for your company.
Okay, and that's actually a good transition into morale. I believe it's okay. We have one more.
I wanted to talk a little bit about trust further. That respect. When you respect your employees, they respect you. So respect your employees, because respect is trust in action. So when we talk about creating an environment that your employees trust you because it's more creative, once that trust is established, action is made. I think it's very important, obviously, to communicate your goals, directions, and expectations. And most importantly, is to create a safe environment for your employees. They need to trust that you're protecting them.
Okay, so the next slide is just an image. It's about, if you guys see me keep looking down, this guy's trying to jump on my lap, which is, I should have put him in a different room. So the image is nice here. So leadership is really what holds up during tough times, right? We talked about action, being leaders. Actually, it's not their title, it's the action that they take. And this is a nice image of a leader really holding the pieces together so they don't fall over. And the next slide is enhancing employee morale. So as we mentioned at the beginning, a lot of these overlap, right? So my opinion is you need good leadership to have good morale. But let's go into some of the key points with employee morale. That should be the next slide. So Rosie mentioned compassion. As a leader, you want to show compassion. It's basically showing that you care. You know, I always learned being in the medical field, there's this important thing where you have your clinical relationship with a patient. And when you look at modern medicine, I'm going off on a tangent here, but if you look at modern medicine, there's this thing called a placebo effect. And a lot of the techniques that we use, and it could be a physical therapy technique as far as something manual, touching somebody, it could be a medication you're taking, it could be whatever it is, but placebo is about 50%. Meaning, if I tell somebody comes to me with back pain and I say, I line 10 people up and I say, drink a glass of half tea and half coffee in the morning, and that's been proven to help your back pain. If those 10 people feel that I care about what I'm doing and I'm an expert, half of them will come back and say they're feeling better. It's just goes to show you how important it is to show people that you care, because when you show people that you care, they'll do so much more for you. They'll really work up to their potential. It's really the right thing to do. And once again, everything goes smoother because your employee morale is where it needs to be. Provide recognition. Let me go through, show you care, provide recognition, promote from within, try to do fun activities, which is a little more challenging now, but we'll give you some examples, and communicate and encourage employee feedback. Want me to keep going?
Well, as far as try to do fun activities, some of the things that we've done is, we have a newsletter, and we've have a mask contest, who wears the mask the best. We've had people send in pictures of their dogs. We've had contests like that. For Father's Day, we did a video with the fathers. Actually, our employees sent in photos of their fathers. It was really beautiful.
We did that
for Mother's Day too. So it's about including the community, including your referral sources, including your employees, and it all goes full circle. It shows, for Veterans Day, we also did a video. Some of our employees are,
it's for Memorial Day.
Oh, sorry, for Memorial Day.
Of the families that have veterans.
That had veterans. It meant a lot to our employees. Unfortunately, a lot of their family members had passed away, either during the time of war, or from complications many years later. So that was something that, it's so important to us to include our employees. We've had other activities, maybe food trucks,
ice cream socials with social distancing. We have a mask, allegiance mask that they have it says allegiance on them, and then a smiley face. It's important to smile. And there's really no limit to fun activities. And that's when you go back to leadership. If you communicate and get employee feedback, you could find many things. A lot of the stuff that we're discussing right now we had nothing to do with. Other people, our employees organized it and asked us, hey, send in a picture of your mother or your dad or a veteran in your family. And they created these videos. Everything it came out really nice. And it's just something fun during these crazy times when, if you look at what's going on, you can look at everything negative and try to have a little bit of fun. It really puts your mind back where it needs to be. As far as providing recognition is really important for morale. We've always had an employee of the month, but we've continued that through these times, even though our employees aren't interacting as much as they have in the past, because our doors are actually locked, with the exception of the 6 key employees that are in our office right now. And it's just a drop-off exchange. We have a table out front where things are picked up and dropped off. But we still want to provide recognition. We still allow our employees to vote for those who are the employee of the month. We have had employees that have gone so far above and beyond during these times. And, you just simple gift card.
Oh yes, gift cards.
Gift cards,
yeah.
It is nice recognition. Everybody, enjoys a gift card here and there. I want to get to the promoting from within. We actually we have a upfront office person that just got promoted to be she's an assistant role in our HR department now. When people see that, and that's just one example of the most recent, that was just 3 weeks ago. But when people see that, it gives them the opportunity to say, you know what, maybe I'm going to have that chance to move up also. So it increases morale. And we keep going back to communication. Communication is so important for all these.
And even as far as enhancing employee morale, that actually can go back to your Zoom meetings or go-to meetings. Employees like to be informed. So when you're creating the meeting, I already talked about dressing professionally, keep your background clean, and make sure that the employees can see each other, because there is a problem now with isolation. So it's nice to see each other's faces. You might even want to start off a meeting with some funny stories that employees might want to share. In the middle of the meeting, I think that's when, if you have a difficult conversation or heated discussion, that should be in the middle of the meeting. And then at the end, keep something, think of an exciting announcement that you can say at the end, something positive. And even that helps with employee morale. Always set a goal for your meeting. So when you open up when you open up your meeting, say what the goal is. You can say a funny story, talk. Then in the middle, do the discussion that might be a little heated, but make sure that you reach your goal at the end, and then finish it off with something nice. Maybe you can ask an employee prior to the meeting to share a nice story at the end, because we're all in this together.
And I always try to communicate. I'm a little different sometimes because I kind of like it when times get tough, because to me, it provides so many opportunities. I don't like it when things get tough just on me, but if things are tough on my whole industry, it kind of creates an opportunity for the people that remain positive and focused on their vision, because there are a lot of people that really crumble when times get tough. And don't get me wrong, I don't want to wish toughness on myself or anybody else, but you could look at when times get tough as a real opportunity. And one of those examples is our sales team. Our sales team is out there getting as creative as they can to maintain the relationships that they have. I mean, they're basically not allowed to go to hospitals, facilities. A lot of physicians' offices have scaled way back, and they've found creative ways to not get down, but to say, you know what, I'm going to find a way of doing this. And when things do return to a normal, whatever that new normal is, now you're ahead of the game. So I think if you can maintain that what am I looking for, that type of thinking with your employees, I think it increases employee morale, because they just look at it as a challenge and they want to get to work.
That goes back to the very beginning when I spoke about what kind of leader are you? Are you going to choose to hide and wait for this to pass, or are you going to choose to be innovative, identify new opportunities, learn new ways of leading? We do have weekly sales meetings, and that is what we talk to our sales department about. What can you do differently? How can you get your name out there? How can you get it clear that we are still open? We are here for you. We have not closed. All of our employees have all the PPE necessary to treat your loved one. We are here for you. And that's one of the challenges that we've had. And I really feel that our sales team has been able to bring that message across.
Okay, so the next slide is enhancing employee health. You're going to hear a lot of the same things, although we'll get a little bit more into health here. It's so important during these times. I mean, it's important all the time. Like it's funny when we were doing the presentation, putting the slides together. It's like these are all things that 6 months ago, before any of this occurred, they were all very important factors for our company, your company. But now we've just had to adjust a little bit. But your health now is so important, because you want to maintain your your immune system, your mental health. You want to maintain everything to get through these times, because the last thing you want to do is get sick and be compromised, which makes you more susceptible to other things. So we have a short video that our director of nursing made a couple days ago, and we want to play it for you really quick. No, there's no volume. We don't have volume. I don't know if anybody else has volume.
We have volume.
Oh, okay, maybe it's just us.
I don't have it. Wendy doesn't have it.
I don't have it either.
All right.
All right, so
We will reshare it with volume.
yeah,
Yeah,
so
thank you.
yeah, I just watched a video with no sound, but we'll just tell you real quick. She was just talking about following CDC guidelines while we are delivering healthcare and ensuring that the proper protocols are followed. We'll talk about some of those anyway as we get into infection control and everything. So enhancing employee health. I'm just going to go through this list really quick, and then we could get into it a little bit more. It's practice infection control behaviors, which I'm sure everybody has been beaten to death about, washing their hands and practicing social distancing and wearing a mask and all that stuff. Let's get into that a little bit more. Promote healthy eating. As we just mentioned, our immune systems are so vital to ward off some of these, not just COVID, but anything. Make exercise a daily habit, which is the same thing. Get proper sleep, practice gratitude, stay hydrated, and stay connected. Staying connected is more for the mental side. But infection control behaviors, there is, and let's talk about that next because there's another slide on that, but promote healthy eating. So as we know, the fuel that we give our body can also sometimes be a detriment to our body if we are eating a lot of, high carbohydrates or saturated fats or whatever it may be that causes inflammatory responses as they're digested or stored in our body. And we know that this COVID-19 is basically turning into an inflammatory process. So we want to do as much as we can to maintain our health so that we are available to deliver healthcare to others. And that involves eating healthy foods and not eating too many calories, because when you eat more calories than you burn, it gets stored as fat and it increases inflammation, especially in your cardiovascular system, your liver. So we want to promote healthy eating. We could talk more about that as much as anybody
And I
wants.
want to mention about promoting healthy eating. If as a team or as an organization, you want to promote healthy eating and maybe start a campaign about healthy eating within your organization with employees. I mean, that creates a great morale builder, and everyone will feel better.
And when I'm talking to somebody or we're having a meeting or whatever it may be, or they mention that they're feeling a little under the weather, I hear the first little sniffle or cough or whatever it may be, first thing I tell them is to get a great night's sleep and drink a lot of water, because we typically don't get enough sleep, which is when your body heals itself, basically. A lot of those good chemicals are produced and released into your bloodstream, like the melatonin, serotonin, all those things. Serotonin is released in your body during deep sleep, and it's reabsorbed within like an hour or two of your waking, the majority of it. Whereas when you release a stress chemical like cortisol, man, that can stay in your bloodstream for like a week or two. It's like, it's not even fair, So you got to really try to maintain your stress levels, and getting proper sleep is one of the ways of doing it. Of course, the more stressed you are, the harder it is to sleep. But maintaining your sleep is basically is the time that your body repairs and heals itself, recharges. Exercise plays a very similar role as eating healthy. It's just really good for your body to get in some sort of physical activity. It doesn't actually have to be exercise. We'll call it physical activity on a daily basis. Even if you're just walking for 20 minutes, we've We started back in January trying to do 10,000 steps a day. Our son came home from Christmas, showed us that our phone counts our steps. We didn't even know it. And we try to do 10,000 steps a day. Not only is it good for your cardiovascular system, your bones, your musculoskeletal system, all that stuff that you're maintaining flexibility in your joints, strength, endurance, all the things that we need just to be functional and to move around throughout the day. It's great for your mental health. Usually, you're doing an activity that you feel is good for yourself. And there's studies that show the increased circulation while you're performing a physical activity actually helps your brain health.
And there are apps that you can get for your if you have an iPhone. But if you do have an iPhone and you're not aware of this, there's an icon. It's white and it has a red heart on the upper right hand corner, and it says health. And that actually tracks your steps. And they say you should do 10,000 steps. It should be your goal, and you can create your own goals. And it tracks your walking. I know it's really hot in Florida. I understand that it's really, really hot, and I understand that it does rain in the afternoon. So usually around this time, it's raining in the afternoon. So in order to keep an exercise routine, it's important to try to do it every day at the same time. If you wait till after work or something always comes up, if you can take the time to wake up early and walk before it gets too hot, that would be great. Walking brings you together with nature. I think it creates a lot of appreciation when you see beautiful things, the flowers blooming. You start actually being grateful for the things around you.
And speaking of waking up early, because we talked about getting proper sleep, it means you got to go to bed a little earlier. If you look at some studies on sleep patterns, the sleep that you get prior to midnight is worth double the sleep you get after midnight. So if you're the kind of person that stays up till like 2 a.m. and sleeps a little bit later, or doesn't get enough sleep, you're robbing your body of some of the real health benefits of getting restful sleep. So remember that every hour prior to midnight is worth 2 hours of sleep, as opposed to after midnight. Practicing gratitude, Rosie mentioned it. That kind of goes back to creating a positive attitude, increasing morale. There are so many things to be thankful for every day, including waking up and taking a breath. It's unlimited. If you were to sit there right now and make a list of things you're grateful for, you could probably write for an hour, just keep going on and on and on about the things that you're grateful for. You can substitute mindfulness in there, or meditation or prayer or whatever it is. But the bottom line is, if you're grateful for something and understand that there is a higher being that is putting these things into your life, it really creates a positive attitude.
And speaking of practicing gratitude, some people during this time, they're actually creating a gratitude journal because they are having very, very difficult mental problems with COVID, the isolation, the fear of the unknown. So there's actually, there are a lot of people who are starting a gratitude journal. And I think that that will also help with enhancing your health.
There's one that says stay hydrated. I should have put that one higher near the healthy eating and the exercise. Hydration is so important to have the fluid content that your body demands, right? Our bodies are going to get rid of 5 pints of urine every day, whether we drink or not. It's very easy to slip into the dehydration mode that your body goes into when you don't have enough fluid. Every body reaction that we have, including a thought, is a chemical reaction. And for every chemical reaction, it needs nutrients, and then there's toxins that are they're a result of the reaction. And those particular toxins, or metabolic wastes, some people call them, are filtered through your body with basically water, through your kidneys and then your urinators. So it's very important to stay hydrated. As you lose hydration, you can develop headaches, lightheadedness, and your body's inability to remove some of the metabolic wastes from your body that need to be removed. And then the last one here is stay connected.
So the title of this slide is Enhancing Employee Health. Part of enhancing employee health is keeping them protected, but also staying connected with them. Having empathy for their situation so that they're not stressing out. Some of our employees have small children, school started, there's just a lot of stress. They're taking care of a loved one. So stay connected with your employees, understand what they're going through, and show them that you care and that you have empathy for them. I think overall it's so important to practice gratefulness. Think about your employees, how grateful you are to have them. Without them helping you, you can't create the environment that you've created. You can't reach out to the community. You can't help other people. It's really a group effort to have employees help you in your mission. I know this is silly, but did you smile today?
I love saying
it
that.
Is so important to smile.
I like saying that to Rosie when she's mad.
Smiling elicits a very positive, a positive feeling. So even when you're mad at someone, or you wake up in the morning, when you wake up, if you just smile, it will change your day. Don't frown when you wake up in the morning, smile. Stay positive. It's so important to stay positive. What does smiling do?
All right, so I always say when Rosie gets upset, which she barely ever gets upset.
Never.
Right? So I always say, go ahead, smile. And she gets a little bit mad. I say, just fake a smile. If everybody right now, if you just go like this and fake a smile, it completely changes your attitude, because we have this mind-body thing, right? When we do something with our mind, it affects our body. Like when we get stressed and we get those pains in our stomach and it causes us to slump up, our mind controls our body, but our body also communicates with our mind and elicits all these chemical reactions I was just talking about. And when you smile, you use these 26 muscles to smile. It actually sends a message to your brain, and you release some endorphins when you just smile. So I always say that to people when I see that they're getting upset with me. I just go, fake a smile, just fake one.
So as a leader, all of these things are important for you in order to lead your own, your directors, your managers, other employees. So you yourself as a leader, you have to think about, are you practicing safe measures so that you don't get infected and you don't infect others? Are you yourself eating healthy? Are you making sure that you're eating plenty of greens? Are you exercising? You know, when you exercise in the morning, it actually opens up your mind and it makes it more clearer to work. Isn't that true?
Yeah, there's a whole book called Spark on this.
Yes, there's a book called Spark on exercising in the morning and opening up your mind. Practice gratitude. Have you thanked your employee today? Can you think about an employee that makes your life easier? Call them up, thank them, send them flowers, do something different to let them know that you are grateful for them. If you want to bring lunch to your office, instead of catering it and having a lunch where everyone goes in and takes it, do individual catering. That's possible, and they appreciate that. Stay hydrated, make sure you drink plenty of water as a leader, because like Joe said, I mean, water is very important. It helps your body, your cells, and stay connected with them. A leader that hides and does not communicate and does not stay connected is not a good leader. So make sure you reach out to your employees.
Okay, so the next slide is Jamie, our director of nursing, who did that video. This is just a picture of her in her PPE equipment. And we were going to talk a little bit more about infection control, because if you think about this, if I maintain my health and Rosie maintains her health, number one, I'm able to do the things that I need to do, but I'm also not a carrier of anything, so I'm not passing it on. So the more that we can all maintain our health from an employee perspective or just a personal perspective, taking on your responsibility, the less we're going to spread something, which is the sooner we could return to whatever normal is, our new normal. So that's an example of PPE equipment.
She does have gloves on, you just can't see them.
Yeah, those are clear. Those are transparent gloves. They're more opaque. But infection control involves reducing the chance of you being exposed to some communicable disease, right? And then taking it and, like I said, passing it on to somebody else. So the obvious one that you've been hearing for the past, I don't know how many months it's been since March, but is washing your hands very frequently. It is the most effective thing to do to not pass on germs, right? So when I was going through school, one of the questions on my boards after I finished was, what is the most effective barrier for a shoe? And it's actually leather. And the reason why it's leather is because it was skin at one time. Our skin is the most effective barrier that we have, as long as there's no, as long as you don't have any open areas on your skin. So as our skin can handle having infection on them, right? But the second we touch an opening in our body, our eyes, nose, mouth, ears to a certain extent, but it's harder for our ears, but it could enter through your ears also, then we have a problem. So if we continually wash germs off of our hands, then we reduce the likelihood of us touching our face, which I've been trying so hard not to do the past few months. But I mean, you get hot and there's a bead of sweat, or you get an itch, or whatever it may be. It's really hard not to touch your face, but that's a good thing to practice also. But when you wash your hands frequently, it reduces your chance of putting one of those germs on a body part that it can get absorbed into and make you sick. Another one that's mentioned all the time is cleaning off frequently touched surfaces, which is where your hands actually collect germs. It is, if you look at studies that were done prior to COVID, like a doorknob is absolutely disgusting. A remote control to the TV, your telephone, a toilet handle when you flush, which I mean, I'm pretty sure everybody knows not to wash your hands after that. But just surfaces, a countertop, like when you walk into an office and you touch the countertop, your keys, your steering wheel isn't as bad because it gets baked by the sun every day. But it's just so important to not only wash your hands, but to clean some of those surfaces, your refrigerator handle, all those things, to reduce the amount of communicable diseases, germs, whatever you want to call it, that are on those structures in case you do touch them and then rub your eyes.
And
right?
If you use a public restroom, try to go in and out as quick as possible.
Yeah, because it's an enclosed space. So we can talk about social distancing. We all know about social distancing, but it really does, let's just say, make sense, right? If we maintain a certain distance from people and we're wearing a mask the whole mask thing is, it goes back and forth. Some people say it's not very effective. Others say it is effective. It's, I'm going to do whatever makes everybody else feel comfortable, right? But I'm going to try to do things to protect myself. But if somebody else feels that I'm protecting them also, then it just makes life a lot easier. So we've been wearing masks anywhere that we're supposed to. And it does make sense that if I cough or sneeze, that it'll collect some of those larger particles, but it's not going to collect the particles. If you're near somebody that's infected, I mean, we're talking about microscopic germs. It's not going to collect those particles, which is why it's important to maintain a 6-foot minimum distance from somebody, because there's almost like a cloud around them of infected air. What else should we talk about? Infection control. Are we missing anything? I mean, this is the equipment that we wear with those. It includes gloves. It includes a fluid-resistant gown, a face shield. Your eyes are a very big pathway to enter your body for a germ. So the face shield, the mask.
I would say when you wear a mask and if you have to go grocery shopping or anything like that, I always make sure I wear glasses, because large particles can go into your eyes. So I think it's important to wear sunglasses or reading glasses even when you're shopping. It's just something, or even when I'm exercising outside and I'm walking, I make sure that I have glasses on.
Okay, and then we have a couple slides that we were going to run through real quick, but we can make it real quick.
And I want to
Sure.
say the point of these slides is that there is a lot of change going on, but there are some things that never change. And the mission of your company and the pledge that you have for your clients and for your employees, that did not change, and that should continue. And that's why we wanted to bring up our pledge.
Right. Some, what is that saying? I can't think of it. The more things change, the more they stay the same. You have to stick to your values, stick to the things that make you successful, the character, the person that you are. You just have to change some of the ways that you have to deliver whatever you're delivering, whether it's a service or product. But your core values are going to remain the same. We have a pledge because we're Allegiance. I'll read it real quick. We will be the best at helping you restore and maintain your maximal level of comfort, function, and health in the freedom of your home. We create clients for life by delivering legendary service, developing and energizing our professional staff, and delivering a superior overall healthcare to meet each patient's individual needs. I think that still sticks to during COVID, all the stuff that we just went over. We believe that comfort, function, and health at home are basic human rights, not luxuries. Most people are at home right now. Each patient becomes a vital and respected member of the Allegiance family. Join us. So that remains the same. We don't have to change that at all for COVID. And then the next slide is our 10 values. We made these. If you heard some of our other presentations, we go through the story of this, but I'll tell it again briefly, is that these values were made, I would say maybe 12 years ago. We had a contest with our employees to tell us what are I think we asked them for five most important things that you feel
are important in the workplace for you as an employee and for you to work under us as leaders.
So these were the 10 most, mentioned qualities or values that we need. And what we do is when you get hired by us, you get a card that has these on it. You have to bring that card to all of our meetings. And we tell you that there is no problem or issue that we have with our company that cannot be solved by following these values. And which is not my role to tell them what to do in their personal life, but these will solve your problems in your personal life too. And there are a lot of the things that we talked about. And I like, as far as the times that we're living right now, the number 10 is awesome too. We talked a lot about the other ones. Balance, though, is to you have to manage your personal and your business life.
Right, a life-work balance. Yes. Yeah. So when we start our meetings, and this can be true for your Zoom meetings, you can have, we have one of our employees read the pledge, and then another employee who might be part of heading the meeting. We ask them to say, what is this value? And if they say it's accountability, they read accountability, and then they talk about accountability to create focus in the meeting.
Yeah, and everything has to be brought back to that value.
To that accountability.
You have to identify what value the meeting is going to
be. Ethics, respect, teamwork, winning attitude. I mean, how important is a winning attitude right now? A poor attitude in poor times will affect the whole team, will affect the whole nature of your mission, of you helping others. Communication, development, change, leadership, accountability, and balance. Be accountable for your actions. If you make a mistake, it's okay. It's okay you made a mistake, but fix it. Fix it. Understand how it affected other people, and change it. an apology goes a long way. A sincere apology goes a long way.
All right, and I think that opens us up for questions.
Actually, before we go into questions, I just want, because I want to make sure I can get everyone to see that video.
Hi, I'm Jamie, the Director of Nursing at Allegiance Home Health. At Allegiance Home Health, our primary concern is the patient's safety, comfort, and well-being. COVID-19 is affecting all of us and has definitely changed the dynamics in which healthcare is provided. Here at Allegiance Home Health, we are providing all of our clinicians and caregivers with the required PPE to keep the patients and the staff safe. We are continuing infection control education with all of our team members. We are also following all CDC guidelines in regards to safety, infection control, and testing procedures. We have an amazing team of caregivers, nurses, and therapists. We would love the opportunity to provide legendary care in your home. Call us.
Awesome.
So Jamie started off part-time with us. She worked in a hospital for 15 years. She started off part-time. She had a young daughter, and the hospital was requiring her to work in the evening. She ended up working full-time as a clinician, and then we promoted her to work in the office as a case manager. Then she became the manager of case management, and now she's our director of nursing, and she's been working for us for 15 years. So that's a real success story.
Yeah, actually, her daughter is almost 16.
Crazy.
She used to come to work in a
Yes.
stroller.
Yes, she did. Jamie's a large part of our organization.
So we're going to open it up for questions. If anybody has questions, I know I've seen in the chat box more praises. Malinka said, thank you, Rosie and Joe. Good reminders on how we should be training our employees and coworkers. Pat Mara, nice presentation, Rosie and Joe. So you have some kudos. I just realized I never turned back on my camera, but that's okay. Does anybody have any questions? Susan.
Yeah, it's not so much a question. I just want to acknowledge you guys because I do a lot of leadership coaching, and you touched on some of the most important things that have an office be successful, from being transparent, and that's the way to gain trust, as far as engaging. Talked about the soft skills as well as the hard, because that empathy piece is huge, especially during stress when everyone's in that fight or flight. And you spoke about self-care, and so many people think that that's trite, and it's just wonderful the way that you're handling things, COVID or no COVID, but especially now. The only thing I would add is also to add some resilience techniques. Like if something isn't working, look at different perspectives and until you find something that does work. But bravo to you guys.
Thank you.
That's why it's so important to get your employee feedback, because
Yes.
a lot of times the best ideas really that become implemented are an idea of somebody that's seeing things a little differently than the way you're seeing things.
Yes.
That's very good point.
Thank you. Thank you so much.
Thank you.
Donna had a question.
Again, not so much a question, but I want to acknowledge Joe and Rosie because they are talking the talk, but I happen to know from personal experience that they walk the walk, and all of their employees do the same. Personally, I have had Allegiance when my in-laws were alive. They were the only people that I trusted to leave my in-laws with who were in assisted living. It was a very, very trying time for us. And every single person that we connected with, from Rosie and Joe all the way down to the direct care, was just incredible. So everything that they talked about today, I personally saw in action, and I can't thank you enough for all you do in our community.
Well, thank you, Donna. That was very nice coming from somebody who really walks the walk. That means a lot, number one. But yeah, we mentioned you in Best Foot Forward, and walking the walk actually is a pretty good saying for you.
Yes.
Best foot forward.
Walking the walk.
Thank you.
But Donna does an amazing
And I
job
can
too.
share that Donna has shared stories about the children that she's helped to go on to college. I mean, children that would have been thrown away, really. And she actually cries because
I'm crying now.
yeah, so invested. She's so invested in the lives of these children and her mission.
But thank you, but really about you guys, and I appreciate being here to get these reminders because it is a very trying time, and you're right. And even with the work that we do, we have a staff of 19, and it's hard because our kids are very, very stressed right now, and we have to work remotely with them. Foster parents are stressed, and so these are all very applicable and valid reminders. Thank you again.
Well, you're welcome. Those are some of the biggest challenges right now, too. If you think about your employees that have children, school-age children. I mean, we got kind of lucky. Like our son graduated from high school in 19, and he went through his first year of college, got acclimated, had his fun and all that stuff, and now he's doing online classes, which is, it's not like the end of the world. He knows he's still going to get a couple more years of the college experience he had in his first year, but we always think about those who just recently graduated this year, or they're going to be seniors this year. A lot of them, our son plays baseball, but I mean, I always think about like the juniors and seniors in high school right now that are trying to get scholarships to play for college. And it's like becomes so much more difficult unless you were already a superstar. There's a lot of people that don't blossom, a lot of kids that don't blossom into their junior or senior year. And some of our biggest challenges have been employees that have younger kids.
And our son is empathetic, and when this was all happening and it was a time of graduation, he kept saying, I feel so bad for these kids that didn't go, they're not going to have prom like I did. They're not going to walk on a stage like I did. These are milestones. And he really did feel terrible for his friends that were seniors. Yeah.
Anyone else? Any last words, Joe, Rosie?
Well, I'll just say thank you for attending. This is fun. We always like reaching out. Use us as a community resource if anybody has any questions, issues about anything, and stay COVID free.
Yes. I would say one of the gifts that we have in life is to help others. And it makes you feel so good to help others. So that's what I leave you with, a big smile and help others. If you feel lost, take charge of your life. And when you do take charge of your life, everything else goes into play. So I wish all of you a great day. And I thank the Chamber, who has been very innovative in a time of COVID. Instead of doing these meetings, there's actually even more people attending, and in a trying time, they have shown how innovative they can be and dedicated to us, the business owners. And I just want to thank the Boca Raton Chamber of Commerce.
Oh, thank you. Thank you, guys. Well, before I let you guys go, I know you all introduced yourselves to each other earlier in the meeting, but if you can take a moment and just put in that chat box your contact information. After the meeting, we will share your contact like a virtual business card, but we need your permission first, so just put that inside that chat box. Thank you, Joe and Rosie, so much for your presentation. The information is amazing. It's totally valuable, especially during this time. We really need to hear things like that. Thank you for your sponsorship and your support of the Prime program and the Boca Chamber. We totally appreciate that as well. If you guys don't already have it marked on your calendar, please put on your calendar that next Thursday, September 10th, is the Golden Bell Education Foundation Grant Breakfast. And we will be giving away over $100,000 worth of grant money to our local public schools. So we want to keep those schools trekking on, keep them A-rated, and make sure that the education of our youngins, who will be our employers and business owners of the future, get what they need. So be sure to check it out. It is on Zoom. We have our great sponsor, Blue Green Vacations, will say a couple of words. We have Frank Barbieri speaking. We have tons of great stuff. We have a couple of prizes that you can win. So be sure that you join that program or that event. And then we also have a First Responders Awards Luncheon. It's the first for our side of the chamber on September 23rd. That will be virtual. We are awarding a Boynton Beach firefighter Boynton Beach police officer and a Boynton Beach EMS of the year. So be sure to check that out. That will also be on Zoom. And you can check out the recording of this video later on today. And I bid you a wonderful, healthy, and safe weekend. Thank you all for coming.
Thank you.
Thank
Thank
you.
you. Stay safe, stay healthy.
You too.
Bye.
Making sure everybody got their contact information in the chat box. I don't want to close you out in the mid-type.